Here are the interview questions with simpler answers. 1. What motivated you to apply for this position? Answer: I love science and want to help in the lab. 2. What experience do you have in a laboratory setting? Answer: I have done training and worked in labs during my studies. 3. How do you ensure accuracy when recording data? Answer: I check my work carefully and follow instructions. 4. What safety protocols do you follow in the lab? Answer: I wear safety gear and follow rules for handling chemicals. 5. How do you handle stressful situations in the lab? Answer: I stay organized and ask for help if needed. 6. Describe a time you worked as part of a team. Answer: I worked with a team on a school project and we divided the tasks. 7. What laboratory equipment are you familiar with? Answer: I know how to use centrifuges, microscopes, and pipettes. 8. How do you prioritize your tasks in the lab? Answer: I make a list and do the most important tasks first. 9. What would you do if you encountered an error in your work? Answer: I would tell my supervisor and fix it. 10. Where do you see yourself in 5 years? Answer: I hope to be a lab technician and learn more skills. Here are some common interview questions for a laboratory assistant position, along with short and precise answers. 1. What motivated you to apply for this position? Answer: I am passionate about science and laboratory work, and I want to contribute to research and healthcare by supporting laboratory operations. 2. What experience do you have in a laboratory setting? Answer: I have completed specific training or education and have hands-on experience in, mention any relevant internships or work experiences. 3. How do you ensure accuracy when recording data? Answer: I double-check my entries, use clear labeling, and follow established protocols to minimize errors. 4. What safety protocols do you follow in the lab? Answer: I always wear personal protective equipment, PPE, follow chemical handling procedures, and adhere to waste disposal regulations. 5. How do you handle stressful situations in the lab? Answer: I stay organized, prioritize tasks, and maintain clear communication with team members to manage stress effectively. 6. Describe a time you worked as part of a team. Answer: In my last position, I collaborated with a team to complete a project on time by dividing tasks according to each member's strengths. 7. What laboratory equipment are you familiar with? Answer: I am familiar with, list specific equipment, e.g., centrifuges, microscopes, pipettes, and have experience using them in various procedures. 8. How do you prioritize your tasks in the lab? Answer: I assess the urgency and importance of each task, often using a checklist to ensure all critical procedures are completed on time. 9. What would you do if you encountered an error in your work? Answer: I would immediately notify my supervisor, document the error, and take corrective action to prevent recurrence. 10. Where do you see yourself in 5 years? Answer: I see myself advancing in my career, possibly as a laboratory technician or specialist, continuing to grow my skills and knowledge in the field. These questions and answers can help you prepare effectively for a laboratory assistant interview. Here are some example lab assistant interview questions along with suggested answers to help guide you. 1. Why do you want to work as a lab assistant? Sample answer: I have a passion for science and healthcare, and I enjoy working in a laboratory setting where I can contribute to important research and diagnostics. As a lab assistant, I'm excited to apply my knowledge in chemistry, biology, and lab safety to ensure the accuracy and reliability of test results. I also appreciate the opportunity to work behind the scenes to support patient care. 2. How do you handle working under pressure, especially with tight deadlines? Sample answer: Working in a fast-paced lab environment requires multitasking and prioritization. I stay calm under pressure by organizing my tasks, breaking down complex procedures into manageable steps, and communicating clearly with my team. I also ensure that I remain attentive to detail, even when time is limited, to maintain accuracy. 3. how do you ensure lab safety and proper handling of samples? Sample answer, lab safety is a top priority for me. I strictly adhere to protocols, such as wearing proper personal protective equipment, PPE, labeling samples correctly, and disposing of hazardous materials properly. I also ensure that samples are stored at the correct temperature and handled according to guidelines to prevent contamination. 4. Describe a time when you had to deal with a challenging situation in the lab. How did you handle it? Sample answer, in my previous lab experience, I encountered a situation where a crucial piece of equipment malfunctioned during a time-sensitive test. I immediately reported the issue to my supervisor, followed the backup protocol to perform the test manually, and double-checked the results to ensure accuracy. This experience taught me the importance of staying calm, being adaptable, and following contingency plans. 5. How do you manage and prioritize multiple tasks during a busy shift? Sample answer, I believe in prioritizing tasks based on urgency and importance. For instance, if I have samples with strict time-sensitive parameters, I will handle those first. I also make use of checklists and communicate with my colleagues to stay on track. Time management is key, and I constantly assess my workflow to make adjustments when necessary. 6. What experience do you have with lab equipment and technologies? Sample answer, I have experience with various lab instruments, such as microscopes, centrifuges, and spectrophotometers. I've also used computer systems to input data and generate reports. In my previous role, I was responsible for performing routine maintenance and calibrations on equipment to ensure it functioned properly. I'm comfortable learning new technologies and following detailed protocols. 7. How do you ensure the accuracy and precision of your work? Sample answer, accuracy and precision are crucial in lab work. I ensure accuracy by double-checking my calculations, calibrating equipment regularly, and following all standard operating procedures. I also verify results by repeating tests when necessary and maintaining detailed, clear records of all lab activities. 8. How do you handle confidential patient information or sensitive data? Sample answer, I understand the importance of confidentiality in the lab. I always ensure that patient data and sensitive information are handled according to HIPAA guidelines or the applicable data protection laws. I take care to only access information necessary for my role and ensure it is stored securely. 9. What steps do you take to troubleshoot a problem with a lab instrument? Sample answer, when a lab instrument isn't working properly, I first consult the troubleshooting guide and ensure the equipment is correctly set up and calibrated. If the issue persists, I check for common problems such as power or software issues. If necessary, I would escalate the problem to the appropriate technician or supervisor. I also make sure to document the issue thoroughly. 10. How do you stay current with lab best practices and new technologies? Sample answer, I stay current by attending professional development workshops, reading scientific journals, and participating in online courses related to laboratory techniques and new technologies. I also enjoy collaborating with colleagues who have experience with different tools or methods, as it helps me stay up to date and continuously improve my skills. Here are some common interview questions for a laboratory technician position, along with simple answers. 1. What interests you about being a laboratory technician? Answer, I enjoy working with science and technology to help people through testing and research. 2. What laboratory techniques are you familiar with? Answer, I am familiar with techniques like pipetting, centrifugation, and preparing slides for microscopy. 3. How do you ensure the accuracy of your test results? Answer, I follow standard procedures and double-check my work to avoid mistakes. 4. Describe your experience with laboratory equipment. Answer, I have used various equipment, such as spectrophotometers and incubators, during my training. 5. How do you handle hazardous materials in the lab? Answer, I follow safety guidelines and always wear protective gear when handling them. 6. What do you do if you notice a problem with an experiment? Answer: I would report it to my supervisor and try to troubleshoot the issue. 7. How do you prioritize your tasks in the lab? Answer: I focus on urgent tests first and use a checklist to keep track of everything. 8. Can you explain the importance of following protocols? Answer: Following protocols ensures safety and accurate results in the lab. 9. How do you handle repetitive tasks? Answer: I stay focused and take short breaks to maintain my concentration. 10. Where do you see yourself in your career in a few years? Answer: I hope to advance to a senior technician role or specialize in a specific area of laboratory work. These questions and answers can help you prepare for an interview for a laboratory technician position. Here are some common interview questions for a laboratory technician position, along with professional answers. 1. What interests you about being a laboratory technician? Answer: I am passionate about the scientific process and the role laboratory technicians play in advancing healthcare. I find satisfaction in conducting experiments and analyses that contribute to accurate diagnostics and patient care. 2. What laboratory techniques are you familiar with? Answer: I am proficient in a variety of laboratory techniques, including pipetting, centrifugation, spectrophotometry, and chromatography. I have experience in both qualitative and quantitative analysis, which allows me to adapt to different testing requirements. 3. How do you ensure the accuracy of your test results? Answer: I ensure accuracy by meticulously following standard operating procedures, calibrating equipment regularly, and conducting control tests. Additionally, I practice thorough documentation to track any deviations from expected results, which aids in identifying potential errors. 4. Describe your experience with laboratory equipment. Answer: I have extensive experience operating a range of laboratory equipment, including automated analyzers, incubators, and microscopes. During my previous role, I was responsible for routine maintenance and troubleshooting of these instruments, ensuring they functioned optimally. 5. How do you handle hazardous materials in the lab? Answer: I adhere strictly to safety protocols and guidelines established by OSHA and the Laboratory Safety Manual. This includes using appropriate personal protective equipment, PPE, following proper waste disposal procedures, and maintaining a clean work environment to minimize contamination risks. 6. What do you do if you notice a problem with an experiment? Answer: If I notice a problem, I first assess the situation to determine the nature of the issue. I document my observations and discuss them with my supervisor or team members to collaboratively troubleshoot and implement corrective actions while minimizing disruptions to ongoing work. 7. How do you prioritize your tasks in the lab? Answer: I prioritize tasks based on urgency and importance, often utilizing a task management system to track deadlines and progress. I also communicate with colleagues to ensure that team goals are aligned, which helps manage workload effectively. 8. Can you explain the importance of following protocols? Answer: Following established protocols is crucial in laboratory settings as it ensures the safety of personnel and the integrity of experimental results. Adherence to protocols minimizes variability and allows for reproducibility, which is essential for valid scientific conclusions. 9. How do you handle repetitive tasks? Answer: I maintain focus and motivation by setting small goals and reminders throughout repetitive tasks. I also ensure to take short breaks to refresh my mind, which helps sustain productivity and attention to detail. 10. Where do you see yourself in your career in a few years? Answer: In the next few years, I aspire to take on more responsibilities within the laboratory, potentially advancing to a senior technician or supervisory role. I am also interested in furthering my education in a specialized area of laboratory science to enhance my expertise and contribution to the field. These professional answers will help you present yourself effectively in a laboratory technician interview. Here are some common interview questions for a phlebotomist position, along with simple and short answers. 1. What inspired you to become a phlebotomist? Answer: I want to help people and be part of their healthcare journey. 2. What techniques do you use to make patients comfortable during the blood draw? Answer: I explain the procedure and use a calm voice to ease their nerves. 3. How do you ensure accuracy in blood collection? Answer: I follow the correct procedures and double-check patient information. 4. What is your experience with different blood collection techniques? Answer: I am skilled in both venipuncture and capillary collections. 5. How do you handle difficult patients or those who are afraid of needles? Answer: I listen to their concerns and try to distract them during the process. 6. What do you do if a patient experiences an adverse reaction during a blood draw? Answer: I stop the draw, assess the patient, and call for help if needed. 7. How do you maintain hygiene and safety in your work? Answer: I wash my hands, wear gloves, and dispose of needles properly. 8. What is your experience with laboratory information systems, LIS? Answer: I have used LIS for entering patient data and tracking specimens. 9. How do you manage your time effectively during busy shifts? Answer: I prioritize tasks and stay organized to keep things moving. 10. Where do you see yourself in your career in the next few years? Answer: I hope to advance my skills and take on more responsibilities. These simple answers will help you convey your points clearly in an interview. Here are some common interview questions for a phlebotomist position, along with professional answers. 1. What inspired you to become a phlebotomist? Answer: I have always been interested in healthcare and the role it plays in patient well-being. Becoming a phlebotomist allows me to directly contribute to diagnostics and patient care, and I find it rewarding to help patients during the blood collection process. 2. What techniques do you use to make patients comfortable during the blood draw? Answer: I employ several techniques to ease patient anxiety, such as explaining the procedure in detail, using a calm and reassuring tone, and allowing them to ask questions. I also assess their comfort level and adjust my approach based on their reactions. 3. How do you ensure accuracy in blood collection? Answer: I ensure accuracy by following established protocols for site selection, order of draw, and specimen labeling. Additionally, I double-check patient identifiers before the procedure to prevent any mix-ups. 4. What is your experience with different blood collection techniques? Answer: I am proficient in both venipuncture and capillary collection techniques. I have successfully performed these procedures on patients of all ages, including children and the elderly, adapting my approach as necessary to ensure comfort and safety. 5. How do you handle difficult patients or those who are afraid of needles? Answer: I approach difficult patients with empathy and patience. I engage them in conversation to distract them, and I explain each step of the process to alleviate their fears. If necessary, I can also collaborate with a nurse or supervisor for additional support. 6. What do you do if a patient experiences an adverse reaction during a blood draw? Answer: If a patient experiences an adverse reaction, I would immediately stop the procedure, assess their condition, and provide appropriate care, such as applying pressure or elevating their legs if they feel faint. I would also notify a supervisor and document the incident accurately. 7. How do you maintain hygiene and safety in your work? Answer: I strictly adhere to infection control practices, including hand hygiene, the use of personal protective equipment, PPE, and proper disposal of sharps. I also ensure that all work surfaces are disinfected regularly. 8. What is your experience with laboratory information systems, LIS? Answer: I have experience using laboratory information systems for entering patient information, tracking specimens, and generating reports. I am comfortable navigating these systems to ensure accurate data management. 9. How do you manage your time effectively during busy shifts? Answer: I prioritize tasks based on urgency and stay organized by using a checklist. I maintain clear communication with team members to streamline processes and manage patient flow efficiently. 10. Where do you see yourself in your career in the next few years? Answer: In the next few years, I aim to expand my skills by pursuing further certifications and training in specialized areas such as blood banking or pediatric phlebotomy. I also hope to take on leadership roles within the phlebotomy team. These professional answers will help you prepare effectively for a phlebotomist interview.